a committee together, the universities, our researchers, Food and Drugs Authority, National Medicine Directorate, and Professor Alexandra, National Medicine. We still have challenges. I cannot mention all of them, but two are worth mentioning. One, the act of charlatanism. The charlatans are becoming too many, just because they don't want to be subjected to regulation. They don't want to be part of GAFTRAM, that is Ghana Federation of Traditional Medicine Practitioners Association. They regulate them, and through them, we are able to regulate them at the Traditional Medicine Practice Council. Our registrar is here, Registrar Tobe. God bless you. And visible, please, I honor your presence. So the charlatan 40,000 practitioners in this country. When we go into our books, when we go to GAFTRAM, we have just like 4,000 just being regular members. Where are the rest? If you go into the books of TMPC, you'll see that we are not even finding them where they are. They are the people who go and stand on the radio, sit there, and then throw dust into the eyes of the people. And they muddy the good work that the government and all of us are putting in to make sure that we develop traditional medicine in this country. This time around, we are going to equip all the enforcement agencies, and we are coming at them so strongly. One challenging issue that we have, the herbal medicines onto the medicines list. We thought that we were done. Evidence through the chief director. And after our celebration, we will have a caucus meeting. And I believe that after that meeting, we will hear good news. Before I bring my speech to a close, I would like to commend the Minister for Health, Honorable Kwaku, MP for Daman Central, our dear Chief Director, Ministry of Health, policymakers, regulators, researchers, academia, and practitioners for their efforts and the level of dedication in ensuring we produce herbal medicines that are safe, quality, and efficacious, and can meet standard, and can also be said that it can meet the test of time at any time, any day. To our dear sponsors, Chinese Embassy, and Professor Samuel Atodankan, CEO of Core Research and Manufacturing Medicine. Today, they come here every year to support the Lekma Hospital in 10 years, ever since we started the collaboration. During the peak of the pandemic, our indigenous practitioners, herbalists, and most families used various forms in its entirety. The question now is, why haven't we still found a cure or treatment for COVID-19? Mr. Chairman, Nana Chair, distinguished invited guests, ladies and gentlemen, our dear panelists and members on the high table, I want us to know that the answer is that the standardization, the efficacy, the quality, availability and preservation of medicinal plants and services has become a major concern to policymakers, healthcare professionals, as well as the general public. Research and development of medicinal plants and services has become the global paradigm shift to ascertain their safety, quality, and efficacy. The time has come, and the time is now, for herbal medicine fraternity to move away from faith-based to evidence-based products and services. I would want to let us dialogue. Let us dialogue here. Are we trying to understand, or let us speak up, even as we try to understand the tripartite ecosystem? This ecosystem is made up of the indigenous practitioners, or practitioners, largely represented by GAFTRAM, the government of Ghana, represented by the Ministry of Health and the Minister himself. The researchers are here, the practitioners are here, government represented, and if even the minister is not here, our able chief director is here. So tell us, why is it that as we speak, we don't have the medicines? The practitioners had played their role, right? They had submitted 33 products. At the time that the Minister for Health in April, May of last year gathered the leaders of GATRAM and asked them to submit products, herbal medicine. Here we stand. Minister supported the research institutions with funds, supported them to do research. Now, the research went through the preliminary stage from Center for Plant Medicine Research. Now, as we speak, the medicines have been sent to Ngugi Memorial Institute for Medical Research. That is where the products are. And as we collaborate with them, the good news we are getting and the feedback we are getting now is that about 5 of them that have been worked on seem very promising. And through the Ministry of Health has done his part and will still continue to support all the evaluations. The cost of evaluation had been borne by the Ministry of Health through our Honorable Kwaku Agyeman institutions to rise up to the occasion. Do introspective reviews. Identify your gaps. Is it human resource capacity? Develop them. Send them abroad. Send them to other institutions. Let them receive training where the gap is identified. If it's equipment, let us set our priority right. Get the needed equipment and let us run. For time is not our friend. I believe that the government is ready to give equal attention to traditional medicine as it's given to the orthodox. Let us prove that we are capable. That is all. In line with that, the World Health Organization, the African Union, and African Center for Disease Control, CDC, jointly launched the Regional Experts Advisory Committee on Traditional Medicine for COVID-19 Response. This committee is accelerating the pace of research by supporting countries to collaborate on clinical trials of traditional medicines in line with international standards. The West African Health Organization will also set up an advisory and steering committee to facilitate development and promotion of traditional medicine this year in May in Ouagadougou, and I am blessed to be part of this committee. At this juncture, I want to throw a challenge to all the universities and research institutions working in the herbal medicine space to change your gear from basic research.
Our own traditional medicines. Presently, we import a lot of traditional medication into our country, not only from China and India, but even from Europe, from Switzerland. And there are shops in Ghana now that are selling herbs, tree barks, leaves, and all that imported into our own country. So what have we got wrong? There are 2 or 3 institutions that help us to do a lot of research and try to get you registered into products. FDA is now giving some limited shelf life for some of our products, but I think we need to do a lot more. We haven't finished COVID yet. Several medications for testing. All we could do was toxicity and one other test. For efficacy, we couldn't do anything. Meanwhile, malaria vaccine implementation program had done trials in our country for WHO to approve malaria vaccine that may be rolled out even next year. Pfizer-BioNTech are doing third clinical trials with their vaccine in our country. And they are done by Ghanaian scientists. So why can't we do clinical trials with our own medication? Government is ready to support. We are about setting up a research fund, and I believe that our researchers will be able to have access to some funding going forward to begin to help us do some of these things. So when we are able to do trials, that is just around the corner. We can do it even now without much money. And then we'll get the FDA registering our products, put on the market, and doctors will have the belief that this can cure without very serious side effects. That is where we should go. But amongst ourselves, we know those who are charlatans. Some of us, even probably sitting here, are selling drugs that are not registered. Various types of concoctions. The leaves are there in the wild. The trees are there in the wild. The roots are there in the wild. Some of us know them. But let the science evidence be utilized to give us confidence in the type of concoctions and medications that we produce. I don't think I have a lot of time to speak. The only good news I can give you that the government is ready to support you to promote traditional medicine, herbal medicine in our country, such that we can also export and bring home some good money. But because we are keeping all that we earn from traditional medication, I don't know how much taxes we pay. That is one reason that we don't seem to know you that much. Some of you are doing very well with FDA support, plant medicine support, but let us see how best we together can also get into government systems by way of contributing a little bit to support what government wants to do for us and our country. Let me thank you so much.
Especially in the treatment of ailments such as malaria, hypertension, venereal diseases, etc. It is therefore not surprising that discussions about the potentials of traditional medicine have been tabled and selected as the theme for this year's African Traditional Medicine Day. The theme, as we've heard over and over again, is the potential contribution of traditional medicine to COVID-19 response. Since the emergence of COVID-19 in November 2019, there have been discussions about the potential use of traditional medicines as a measure for prevention, management, and possible treatment for this novel coronavirus. As a federation with over 40,000 members in Ghana, we believe that it is our responsibility to provide safe and efficacious medicines to the people of this country. We are optimistic that the lasting solution for the global pandemic lies in the power of plants and traditional medicine. A number of allopathic drugs were derived from traditional medicine. Examples include digitoxin from Digitalis purpurea, morphine from Papaver somniferum, artemisinin from Artemisia annua. Potentials of traditional medicine as a response to COVID-19. There are factors